Conceptually, fair market value is the price of a service exchanged between a willing buyer and a willing seller, with neither being under the compulsion to buy or to sell. And then both parties need to have a reasonable knowledge of facts related to the actual transaction. So in practice, fair market value requires companies to compensate third parties like physicians and clinical research centers on the basis of an objective assessment of the service they are providing. Like, for example, knowing what the number of hours that they're going to be working on a particular service multiplied by an hourly market rate. In the context of increased global transparency requirements, fair market value is also important for two additional reasons. First of all, we see that there is a risk of an illegal kickback associated with non-compliance to fair market value requirements. If we're paying somebody too much for a particular service, a prosecutor could easily make the argument that he or she was paid too much because he or she was prescribing a lot more on behalf of the company and we were inducing them to prescribe more. And then second of all, there's the increased reputation and perception risk, where if you start publishing rates out on a public website, the public will be able to scrutinize those payments and ask questions. And that's something you want to avoid. But also, fair market value makes business sense. It allows companies to implement industry best practices, like creating consistency and transparency for the HCPs in the way you pay them and compensate them and reimburse them, and also harmonizing the practices across different countries. Basically using best practices that you learn in one country, or learning best practices from your competitors or other businesses in the market and implementing them in your own business.